A study came out earlier this year that looked at 3 young athletes with concussion-like symptoms who had repeated movement testing as part of their evaluation. These patients were young athletes between 15 and 16 years old, a football player, a wrestler, and a softball player who had reported acute head and neck trauma and subsequent symptoms that align with what we think of a concussion or a brain injury. That is lightheadedness, sensitivity to light, feeling spaced out, some neck pain, and so on. And yes, these symptoms obviously can come from brain injury like a concussion, but what this case series illustrated is that these symptoms can also conceivably come from the neck joints because these symptoms in these 3 patients were resolved in 2 to 3 visits using only neck movements. Using repeated movement testing as part of an algorithm with evaluation and treatment helps clinicians find that specific movement that a patient needs to abolish signs and symptoms. If that is the case, we would call that a joint derangement. But the layperson can think of it as a tweaked joint or a joint that's mechanically not working well that needs to get back on track with a specific movement or two. For these 3 young athletes, the movements included neck retraction, sustained neck retraction, and retraction extension of the neck. Like other patients who use repeated movement testing and repeated movements as treatment, the crux of the matter was to do the movement throughout the day, every 1 to 2 hours, and make any postural changes that would align with the program. For example, if extension is the beneficial movement or the movement that we're investigating to see if it's beneficial, we would want to contemporaneously reduce the amount of flexion through that joint. So I think this case series is really helpful in understanding that possibly symptoms that seem like concussions could be due to another pathology. People will say that case series is not very robust evidence. I disagree with this kind of putting randomized, controlled, blinded studies as the pinnacle of evidence in medicine. If you want to wait for an RCT that looks at using repeated movement testing or not with patients presenting with concussion-like symptoms, you're going to be waiting for a long time. The idea that I think is key is that repeated movement testing should be a part of the arsenal of clinicians, not only people in orthopedics. If I had a perfect world and can wave a magic wand, all clinicians would understand repeated movement testing because these patients may have seen someone who specialized in neurology, for example, but that neurologist, you would want to be able to use repeated movement testing in the event that that clinician thought it was necessary. So consider repeated movement testing a very important test that helps distinguish the diagnosis. It really bifurcates if it is a joint disorder that will respond to specific movements or it's not. And if it's not, then we can consider, is it concussion? Is it tendinopathy? Is it fracture, possibly stress fracture? Is it ligamentous, etc.? But I'll link to the study below, or I'll put the study's name below so you can read it for yourself. But just remember that all symptoms can overlap with multiple diagnoses, but signs should help distinguish between them, meaning you do something or you apply a certain test and you get a different answer that really separates the diagnoses. In this case, symptoms that seemed like they were brain injury were symptoms of a mechanical problem, but the way that we distinguish is the change in the presentation with movement, which is a sign that separates those 2 diagnoses.